people are starting to really, slide into some levels of, I guess, normalcy, but we're not 100% there yet. And just to find out where we are, get a temperature check, we got Dr. MJ Collier, the hip-hop doc on the line. Good morning, brother.
Good morning, Head Craig, and the Morning Hustle Show crew. It's a pleasure to be here once again, bringing you your coronavirus update. And let me tell you,
man.
Craig, we are not where we need to be with this disease process. In the U.S. right now, we have 1,380,000 cases, 82,000 deaths. And the people are becoming numb to the numbers. They are not, excited about it anymore. And people are just, once they open up, they told you to continue your precautions, social distancing, mask wearing, and also you need eye covering. If you're only wearing a mask, you're only protecting 50% of yourself. So you need to also wear eye coverings as well. Now, some of the things that have changed in the last 2 months, because initially we were thinking that children were not at risk. This was not a problem that we had to worry about. Even if children got it, it was mild and there was no problem. Well, now we're seeing what's being described as pediatric multi-system inflammatory disease. And this is not directly caused by the coronavirus. The child will get the corona. They will get over the corona. But then their body has a unusual inflammatory response that affects the blood vessels, the walls of blood vessels, and can even result in heart attacks in children. So there are, about 90 cases documented in New York, but they have found cases everywhere in the United Kingdom, Spain, Italy. So this is definitely affecting the children as well. We should still be quarantining in place. We're not. So if you decide to go out, then you need to protect yourself. Standing in line to buy shoes at the mall, shoulder to shoulder with people, is just taking your life into your own hands. And everybody at this point knows someone who has tested positive, knows someone who has been hospitalized, and possibly and probably knows someone who has died as a result of this disease. So this is real, and we understand that you have been on lockdown and the weather is nice, that you want to get out and do things. But the only thing that has changed is that 2 months have gone by. We still don't have a definitive treatment. We still don't have a vaccine. So we're still at the same risk. A week from now, the numbers are going to skyrocket, and I'm hoping that African Americans are smart enough to not be a part of this social experiment.
Gotcha. Now, real quick, Doc, I got a couple questions here. First one is,
yes, sir.
Now, people want to find out where they can go and get tested and whatnot. And I know it kind of varies from place to place. Is there like a universal place where they can go to find out where local testings are in each city?
I would just say Google, because it varies so much in different cities. But one thing about it, Craig, and I'm glad to see this, that a lot of the restrictions on testing, i.e. you had to have symptoms, you had to have a fever before they would test you, are being relaxed. And from my personal philosophy, you should be able to get tested on demand, because everybody has been exposed. People are carrying it asymptomatically, and you've been out and about. It may be from a family member or a coworker, but everybody has been exposed. So, testing should not be difficult. I would not necessarily recommend going to a hospital setting to get tested unless you do have symptoms, but they are testing in the community, a variety of different social organizations. Churches are doing it. They have drive-up, set-up, testing areas, and it varies from city to city. But what I do recommend is everybody, if you see testing is available, particularly at one of these free sites, then go get yourself tested.
Okay. Now, another question I have is, there's a lot of people who are not going to the hospital because they feel like, they can't because it's not safe for them. Case in point, they're saying one of the things that possibly took out Andre Harrell was he knew he had heart problems. He should have went to the hospital, but he didn't because he was afraid to go because of, everything going on with Corona. How should you be moving if you're dealing with issues that are not Corona related, but you need to be seen by somebody, but you have that worry about you?
One, if you are already aware that you have a disease process like heart disease, you need to contact your provider first, your cardiologist, your primary care provider, your internist. Have contact with your doctor versus just going to the hospital in the emergency room. But if you do need to go to the emergency room, the hospitals are not overwhelmed. They are making precautions. We have learned a lot about protecting people in the ER from each other. So, don't hesitate. But I'm observing that phenomenon even in my private practice, Craig. people are afraid to come to the office. So I'll get, no-show visits from people about their blood pressure and their diabetes. But, but everybody with corona symptoms are really coming into the door.
Hey, Doc, quick question. What are you, with there not being a vaccine and with there not being any type of way to really preventatively do this or treat this, what are they suggesting, or what can somebody do who is quarantined in place to kind of treat these symptoms and to treat the possibility of maybe having the virus if they're just choosing to stay in and self-isolate? What does that look like?
Everybody should be trying to boost their immune systems. And that means I would take, and CDC has recommended vitamin D. You need to take at least 5,000 international units per day of vitamin D, omega-3 fish oil, probiotics. Everybody knows that they are great for boosting the immune system. Zinc supplements, at least 40 milligrams per day. And elderberry extract. All of that's at least 5 supplements that people can take to boost their immune system and to protect themselves. I have more.
Do you recommend CMOS?
On my website at LipoDrops, LipoDrops.com. There's a full page dedicated to the coronavirus and what things you can do to boost your immune system.
Okay. Now, he was asking, how about CMOS? And, I also see remdesivir, popping up a lot. Like how effective are those things?
Okay, remdesivir is a stopgap measure. It is not the silver bullet. All it does is modify the disease process. So it may stop you from having a severe case and you have a moderate case, or it may shorten the disease process from 14 days to 11 days. Compare it to Tamiflu when you have the flu. It doesn't cure it. It just slows down the infection and shortens the course of the disease. And so, 4 days can be important. I guess you don't want to be sick for 4 additional days. But, again, this is not a cure. And they're only using the remdesivir in the sickest of individuals because it's an IV therapy. You have to be in the hospital environment to get it IV. It's not pills or tablets. So we're still looking for, I'm still using azithromycin. I'm still using hydroxychloroquine. One, because it's working, and every hospital in the world is using it, patients that are sick. And so, the United States sometimes become proprietary with their science, but things that are working in Europe, things that are working in China and Asia, are things that we should be utilizing.
Got you. Now, you probably get a lot of emails that we don't get to see because you're in the medical community. In your personal guesstimate, how far away do you think we are from a fully working vaccine?
I would say at least a year. But there's a new technology where they're creating a vaccine. The vaccine technology has not changed since the days of Jonas Salk and the polio vaccine. So we've tweaked it a little bit, but it's still basically a 3 to 5 year process. But there's a new, totally different approach that's being looked at, and it seems to be working. It's creating a vaccine synthetically, and it gives you a higher immunity. The question is, how long will that immunity last? But if you have to get multiple shots of that, then you have to get multiple shots of it. But I think that's really going to be a big breakthrough in treatment. But right now, the most effective, I think, for immediate treatment is convalescent plasma. And that's where they take antibodies from people that have survived the disease, and they inject them in you, and you have instant antibodies. Even with a vaccine, your body has to get the shot, and then it may take weeks or months before you actually have immunity and before it does you any good. Whereas if you get these instant antibodies from a plasma infusion, then you immediately are able to fight the disease process. And there are multiple cases that have been documented of people that were on death's door and they got a plasma transfusion and they recovered.
Now, what is the likelihood of this disease overlapping or this virus overlapping? Because we still haven't eradicated it. We're not really that far down the road from, getting it out of here. And, next thing you know, October is going to be here. It's flu season all over again. And we're still dealing with, COVID-19. Do you think another outbreak will, lap and be on top of this one?
I think that it's definitely going to happen here, Crack. We're going to have, when people go get tested, right now they test you for influenza A, influenza B, and strep throat. Now they're going to probably have the coronavirus in there as well, and it's possible that you could get all of those things, and really, really compound the challenge to your immune system. So, again, this is not going anywhere. We have not changed anything. The only thing that did change was, staying at home and in place. self-quarantining. And now that we've opened that back up, again, those numbers are going to skyrocket in about a week. And then 2 weeks from that, the death rate is going to markedly increase. And, and I'm hearing people saying it's my right to go out, it's my body, my life, but when you get it and then you spread it to 8 or 10 other people, you're affecting a lot of people. And, and so our objective is to try to stop that phenomenon from happening.
Well, thank you so much, Dr. Collier, for pulling us up with this information. It's very eye-opening. I was contemplating putting my kids back in daycare, but it sounds like it's not time for that. Well,
no, it's definitely not time for that, Greg. Keep those kids at home and to do what you have to do to stay safe. And everybody, this is not the time to go out and go bowling. This is not the time to go out and get a tattoo. I would even recommend going to get a haircut. If you can get a barber to come to you, that would be better. Or get a private appointment where it's nobody in the shop but you and your hairgiver.
Cool. Definitely going to stock up with some booze, too. Thank you so much, Dr. MJ Collier. Man, people want to follow you. Where can they go?
They can reach me on all social media, Craig, at ASK Dr. MJ. ASK Dr. MJ.
We are the Morning Hustle.